Have you ever noticed small, shadowy forms drifting across your field of vision? These shapes, often described as spots, strands, or cobwebs, are commonly known as eye floaters. They can be quite distracting, especially when you're trying to focus on something important. But what exactly are these mysterious shapes, and should you be concerned about them? Eye floaters are actually not external objects floating in front of your eyes. They are tiny clumps of protein or other cellular debris that exist within the vitreous humor, the gel-like substance that fills the inside of your eyeball. As light passes through your eye, these clumps cast shadows on your retina, the light-sensitive tissue at the back of your eye, which your brain then interprets as those bothersome shapes. While most people experience eye floaters at some point in their lives, they tend to become more common as we age. This is because the vitreous humor, which is normally gel-like, begins to liquefy with age. As it liquefies, the collagen fibers within the vitreous can clump together, forming those pesky floaters. To understand eye floaters better, let's delve a bit deeper into the science behind them. The vitreous humor, where floaters reside, is a clear, jelly-like substance that fills the space between the lens and the retina of your eye. It plays a crucial role in maintaining the shape of your eyeball and allowing light to pass through to the retina. Floaters themselves are typically composed of microscopic strands of collagen, a protein that provides structure to the vitreous. As we age, the vitreous can shrink and pull away from the retina, a process known as posterior vitreous detachment, or PVD. This detachment can cause the collagen fibers to clump together, forming the visible floaters. In addition to collagen, floaters can also be composed of other cellular debris, such as red blood cells or clumps of hyaluronic acid, another component of the vitreous humor. Section 4. Not just floaters, the blue field entoptic phenomenon. While eye floaters are the most common cause of those mysterious shapes in your vision, there's another intriguing phenomenon that can create a similar effect, the blue field entoptic phenomenon. Unlike floaters, which are shadows cast by objects within the eye, the blue field entoptic phenomenon involves actually seeing your own white blood cells. If you've ever looked up at a bright blue sky and noticed tiny bright dots moving quickly across your vision, you've witnessed the blue field entoptic phenomenon. These dots are actually white blood cells, or leukocytes, moving through the capillaries in front of your retina. The reason we see them as bright dots is due to the way light interacts with the blood cells and the surrounding fluid. Section 5. When to worry. Seeking medical attention for eye changes. While most eye floaters are harmless and simply a normal part of aging, there are certain situations where they can signal a more serious eye condition. It's essential to be aware of these warning signs and seek prompt medical attention if you experience any of them. If you notice a sudden increase in the number of floaters you see, especially if it's accompanied by flashes of light or a loss of peripheral vision, it could be a sign of a retinal tear or detachment. These are serious conditions that require immediate medical attention to prevent permanent vision loss. Other warning signs include eye pain, redness, or a shadow that appears in your peripheral vision and doesn't go away. While these symptoms don't always indicate a serious problem, it's always best to err on the side of caution and consult with an eye doctor to rule out any underlying conditions.